but her career really spans over the last 20 years, and she has experience not only as an education specialist, but also she's served on the Education Practice Commission, monitoring and disciplining teachers in Florida. She's also served on the inaugural board of the Florida Center for Nursing, and today she serves as a member of the Florida Board of Nursing. So she comes to us with a lot of experience and insight, and we're happy to have her and welcome her.
Welcome. It's so nice to see everyone this morning. And thank you for allowing me to come and speak. I've been looking forward to this all year, actually. So what I wanted to focus on was some of the things that we deal with in the inpatient world. I look around and I see a lot of our inpatient colleagues and outpatient colleagues, and I'm really thrilled that you all are here. So feel free to jump in and share some of your experiences as well. So I'm going to talk about graft versus host disease. It's one of the common complications of allo transplant. And what it is, it's when the immune cells of the donor recognize the transplant recipient as foreign, or the enemy. So when I started thinking about it, when people get organ transplants, it's usually our body rejecting the organ. But in this case, it's the donor cells actually rejecting our body. So that's kind of the simple way I thought about it. It is most common in our allogeneic transplant patients, and it occurs in about 30 to 60%. So it's a pretty high rate. It can be both acute and chronic. So there's different definitions of GVHD, and it's basically based on when these symptoms appear. So classic acute GVHD usually develops within the first 100 days following the allotransplant. And that's usually when we see them in the inpatient setting. Persistent, recurrent, or late onset acute GVHD occurs later than the first 100 days. And these do have features of the acute, not the chronic. Classic chronic GVHD occurs anytime post-transplant with the distinctive features of chronic GVHD, not acute. And overlap syndrome is one of the newer categories where the symptoms can present any time